Am I going to be able to get treatment, or am I going to buy groceries?
Welcome back. I'm Scripps News Group Political Director Andrew Rafferty. Coming up in our next hour, we will hear from lawmakers in anticipation of President Trump's first address to a joint session of Congress in his second term. But right now, we continue to hear from the American people on the state of the country. Some might say that the state of health care is at a breaking point, and for many, the high cost of care and access to life-saving medication is putting Americans at a disadvantage. Others, like Health and Human Services Secretary Robert F. Kennedy Jr., believe that the food we eat is causing chronic disease and killing Americans at a younger age than ever before. David Johnson is a prominent researcher and author of several books on the American health care system. He also is the CEO of Foresight Health. He joins us now from Chicago. David, thank you so much for joining us tonight. As we prepare to hear President Trump's address to Americans, I'm interested in hearing about what you're seeing as the state of America's health care.
Well, the overall state of America's health care is horrible. If you were to look at us relative to other wealthy countries, we spend more per capita and die earlier. We focus all of our resources, or almost all of our resources, on high-cost crisis care in high-cost settings rather than doing the logical things of promoting health and preventing and managing illness in the earlier stages. But it's terrible. Sorry to make that case, Andrew, but it just is.
Yeah. Well, you know, it's terrible in your opinion, and it comes at a really interesting time when we're talking about what the future of healthcare could look like under Donald Trump, and specifically his Secretary for Health and Human Services, Robert F. Kennedy Jr. What do you make of his appointment and confirmation, and what are some of the things you'll be looking for over the next 4 years as he potentially upends America's healthcare system?
Yeah, the Trump administration isn't afraid to flood the zone, move fast, and break things. Robert Kennedy is an enigma in a lot of ways. He is among the most cogent voices on the threat that chronic disease, the enormous threat that chronic disease poses to the body politic in the United States of America. At the same time, his positions on vaccines have been very counterproductive. He reversed his position on measles vaccine this week. So what I'm going to be looking for is, will he turn this passion of getting America healthy again, making America healthy again, MAHA, getting us all healthy together, into tangible policy that helps everyday Americans make smarter choices about how to live longer, eat better, move more, be part of their communities, and so on. That's our biggest challenge as a country. My shorthand for this is, in the United States, we like to say that we're the land of the free and the home of the brave, but increasingly, we are the land of the sick and the home of the frail, and we cannot endure half sick and half healthy, which is the road we're onto right now.
And obviously, another huge concern for Americans is the overall price and cost of health care. What are you looking for in terms of what the next administration and RFK might do to address the seemingly rising costs of health care in this country?
Basically, our entire model is predicated, it's an artificial economic model. It's predicated on providers, insurance companies, suppliers, the whole industrial complex generating as much revenue as possible, separate and apart from generating good outcomes. So the extent to which the Trump administration can shift the focus toward value, transparency, getting the best outcomes at the lowest cost. And by the way, they just announced earlier today that they're doubling down on their transparency initiative. So hospitals are going to have to be much more transparent and accessible in terms of what their actual prices for services are. The more that they're pushing toward value, the happier I'm going to be.
Yeah, and you know, for those watching the speech here coming up shortly, what would you be looking for when it comes to Donald Trump addressing health care? What would you like to see him make a priority in his address to Congress tonight?
I'd like to see him make several priorities. One, the I hope that he talks about the transparency initiative. It's really hard if you're a consumer to make a judgment on value if you really don't know what the price is that you're paying. And most healthcare services are commodities. So one, I'd love to see a real commitment to double down on transparency. I'd also like to see a real commitment to doubling down on something they call interoperability, which is the exchange of data between healthcare providers and various companies that provide healthcare services. Right now, much of our medical data is protected and not subject to best use in practice. There are ways to protect data and make it interoperable. That should be a focus. That was a focus of the Trump term, first Trump term. And then on the Make America Healthy Again agenda, we just have to figure out how to make the everyday lives of Americans healthier and better. We've gotten very good at prolonging the lifespan of sick people. We should be promoting longer health spans. Interestingly, there was a Goldman Sachs study that came out earlier this week that said by 2028, 60 million Americans will be on the GLP-1 drugs. And they believe that will add 1% to the economy, 1% growth to the economy, several hundred billions of dollars, right? And that will be because Americans are healthier and more productive. So that's my hope, is that the Trump administration has a health agenda as much as a healthcare agenda. And that's what I'm going to be looking for.
The healthcare space might be one of the most interesting to watch over the next 4 years. David Johnson, thank you so much for joining us. Coming up,